Texas Senator Kay Bailey Hutchison is a Republican on the Appropriations, Commerce, and Budget Committee. I'm thinking so far ahead to what I want to ask you, Senator, that I said resource, not recess. But I guess the first question to ask, and welcome, thanks for joining us.
Thank you,
do you have any hope that for the American people we can do this in a bipartisan way and really get behind something so important down the road?
Joe, I would like to think that we could, but in fact, the Republicans have been shut out. There is no bipartisanship here. There were something like 45 amendments on the health care bill that came out of the Senate committee. 2 Republican amendments were put on out of 45 offered. It's just not the case that Republicans are being listened to, and if the Democrats want to pass their own plan, of course they can, but this plan is so flawed, and the American people are seeing how much it is going to cost. It's going to increase debt, it's going to increase taxes, it's going to penalize small business for hiring, and it's going to cut hospital reimbursements to pay for it, and it's still not going to be paid for. Everything should be on the table here for trying to either drastically reform this bill or stop and start all over.
Are you counting on Senators Grassley and Baucus to? Do you see any middle? Are they getting any closer? Is there any middle ground there to speak of? It seems like Senator Grassley, and I'm sure you talked to him, is the public plan, there's no way he accepts it, and is there any way that the president will have a reform without a public plan? How do you get these two sides together?
Well, the public plan and the concern about it is, of course, that it is going to drain people out of the private sector and their personal insurance. The president really stepped back from the promise that you wouldn't lose your coverage because he didn't factor in that this low-cost plan that will not offer the choices and the services and will ration health care is going to cause employers to stop giving health care. They're not going to stay in a private plan when this health care option can cut costs so much. Well, when you cut those costs and you take out the competition, of course, you're going to cut quality. And this is really the introduction of the government health care plan that we see in Canada and Great Britain.
Senator, Secretary Sebelius was on with us a little bit earlier, and I asked her a question about what about the costs beyond 10 years, and what about the fact that we already are $38 trillion in the hole for Medicare? What are your thoughts? Unfortunately, she didn't really answer the question.
Well, I think that they don't want to look at beyond 10 years because the estimates for the first 10 years are so horrendous, and you know that is going to increase as more people go into the government plan. It's going to be a government-run healthcare system in America, and the costs are estimated at $25 trillion on in the out years. And we're already being saddled by the biggest debt that we've had since World War II with all of this spending that isn't helping our unemployment situation. So, Carl, I think that it is very important that we look at for instance, the Washington Post, which says that this is a plan that is going to increase taxes on small business to the greatest rate since the tax law was changed in 1986, and that small business will be paying even more taxes than corporate businesses, and we already have the highest corporate tax rate in the world. So it's just, it's an economic killer, it is a job killer, and it's going to knock down the quality of our healthcare system.
Senator Bobby Jindal has an op-ed in the Journal today talking about how to make this reform bipartisan. He says that the administration has resorted to a fundamentally dishonest approach to reform. Do you think that's true? And if the plan is so dangerous to corporate America, why has it drawn the support of groups like Big Pharma, like the AMA, groups that you would ordinarily think would be hostile to this kind of thing?
Well, the AMA came on board because they didn't cut the doctor reimbursements. In the House plan, they've now offered a 5% increase over Medicare reimbursements to doctors, and that, in my opinion, cause the
them.
doctors to come. I was trying to think of a nice word.
So he sweet-talked the group. Is that what you mean?
I think he did. I think he bought their support. But hospitals are going to be cut. So
Well, the hospitals say they've given enough. The AHA, the American Hospital Association, says they've already given as much as they're willing to give.
well, I mean, of course. I mean, hospitals are already struggling, and they're going to cut the added compensation for treating indigent patients in rural hospitals and urban hospitals. So all that will be cut back, and hospitals are going to have to cut back on services or close their doors. This is just, there's just nothing coming out that's factual that says this is good for the patient, for our healthcare system, or for our economy.
Senator, what do we do about illegal immigrants? You're from Texas, and you have a disproportionate challenge associated with illegal immigrants. What are your thoughts about whether and to what extent they ought to be covered by some type of a health care plan, no matter who's sponsoring it?
Well, it's a very hard question because, of course, illegal immigrants are treated in emergency rooms. So you're giving primary care at the most expensive rates in emergency rooms because they don't have coverage. And that's why so many hospitals in Texas are struggling. And the taxpayers are paying for it through county-funded hospitals. And yet you can't have a government-run health care plan that gives a benefit like this to illegal aliens. That's not right either. It's a very hard situation, and what we need to do is try to get a handle on illegal immigration by having a legal way to come in, a guest worker program, secure our borders better. These are the things that would help that situation, but the healthcare costs of illegal immigration is huge. 80% of the babies born in some of the hospitals in North Texas are for illegal aliens. So you've really just got a huge problem in that regard. But let me just say that there are some answers to healthcare reform, and we need to be looking at positive ways to address the high costs and also to give small businesses an economical way to offer healthcare, healthcare that could be offered by a private employer at a reasonable cost is the answer here to increase the number of insured and cut costs for everyone.
All right, Senator, you know, we get the summer doldrums. Now we have this August deadline looming, and we're all sort of watching it with rapt attention to see what happens. I don't know if anybody should be drawing a line in the sand like that, because it makes us all just that much...
Oh, it would be terrible to rush this. You know, Mitch McConnell said the other day that Margaret Thatcher reformed so many things in Great Britain, but because they had gone to this government-run health care, even she couldn't reform that because it was so big and so entrenched. I don't want to do that to our country, and rushing this thing through and possibly having a health care plan from which we cannot retreat that deteriorates our ability to do research, the care that our patients get, would just be unthinkable.
That's true. All right, thank you. Senator Hutchison, we appreciate your time this morning. Thanks.